My name is Toke Ayeni. I'm here to make a presentation on the biopsychosocial review on smoking. First, I would like to give an overview on smoking. Funk and Wagner define smoking as an inhalation and exhalation of fumes of burning tobacco. These scholars asserted that smoking was not initially viewed as dangerous or harmful until the recent 70s, when clinical revealed that smoking was the major cause of lung cancer, bronchitis, coronary arteries, post-surgery infections. The Diagnostics and Statistical Manual classified tobacco as an addictive substance. It is classified with substances that are injurious to the brain and can affect the brain functions and memory productions. Such substances assumes a pathological pattern that the individual continues the substance despite the knowledge of its dangerous effects. Such individuals are faced with daily obligations of failure in their social, personal, and occupational functions. In addition, the global smoking history reveals that from the year 1920 to 2005, there was an increase in cigarette use per day by adults, and which was proportional to the increase of lung cancer, as illustrated in the graph below. The focus of this paper is on biological, psychological, and social factors that could contribute to the development of smoking. In addition, evaluating the smoking cessation programs that could be effective in correcting the problem. One of the reviews was done by Oliver Lubman and Fraser in highlighting that the biopsychosocial review to smoking can be located in the fact that psychiatric patients take more to the habit of smoking because of their mental conditions. The biological explanation for this is that nicotine contains over 4,000 chemical compounds which activate the brain cells on contact, leading to the release of dopamine and brain malfunctions. The psychological explanations by the authors was that psychiatric patients are unable to face the daily symptoms of the mental condition and depend on the use of tobacco to escape from the symptoms of the mental conditions. The clinical experts are also in the habit of the wrong usage of tobacco. This is because tobacco is being used as a reinforcement for medical compliance and violent behaviors. A diagram here indicates that the use of tobacco among adults with mental illness when compared to adults with no mental illness is on the increase. The histogram here indicates the ratio is from 32% to 20%. The review made by the authors is very enlightening, but there is need to re-educate the health workers on the hazards of wrong methods of reinforcement. This will help reduce the smoking habits among the psychiatric patients and develop a better and healthier strategy of coping with mental conditions. A similar assertion was done by Oliveira 2015 to indicate that tobacco smoking was responsible for majority of deaths and the cardiorespiratory diseases. This was done based on the information that the population of tobacco dependence among the psychiatric patients is on the increase. The authors attempted to investigate this phenomenon by assessing the social, demographical, and clinical factors. The patients were randomly selected for a 43% interview, and their tobacco dependence level was assessed through a nicotine test. Results indicated that patients who have psychiatric conditions depend on tobacco 3 times more than patients without tobacco. This is also indicated in the box plot. When we look at the box plot, patients without tobacco are from 0 to 1.9, while patients with tobacco use are from 0 to 3.5. A similar review was made by Hughes et al. In an attempt to investigate the possibility of smoking among psychiatric patients. This was done by selecting a sample population of 277 psychiatric patients in the medical care in Minnesota versus a sample control population of 1,440 Minnesotans and 17,000 US citizens between the years 1980 and 1981. Data was collected using a sample, a questionnaire, and an interview in a 2-hour session. Results indicated that psychiatric patients versus the control population share a ratio 52% to 30% as regarding the use of tobacco dependence. Although the authors were able to come out with a good concept, but this method cannot be relied upon because of the design. There is no way to determine if the factors responsible for the use of tobacco is dependent on their mental conditions. However, this is a very useful information for intending researchers. The next set of reviews highlights on the psychosocial factors that could be responsible for the smoking behavior. The first was done by Avenoli and Mary Kangas to assert that social network, biological and genetical, and environmental factors could affect smoking. In addition, Jane et al. Illustrated that smoking process, the smoking initiation process, are dependent on an individual's perception of smoking, social pressure, and life events. All these factors together predict whether an individual will develop smoking or not. In addition, the personality of the individual can also affect smoking. In order to investigate this, the authors conducted a survey assessing the socio-economic status of the clients, and the use of tobacco and personality traits of the adolescents. Results were computed using a univariate, multivariate, and linear regression to determine the predictive powers of the independent variable. It was discovered that social pressures and perception of an individual predicts an individual's smoking habits much more than other independent variables. This is a very important information that gives a further direction to intending researchers. There's need to decide if perception of smoking, social pressure, life events or personality together predict how much of a smoking habit an individual can develop, or if either of these independent variables have the higher capacity to predict smoking than other variables. A similar investigation was done by Leo et al. To assert that psychosocial factors could be responsible for smoking behavior among coal miners. This is because coal mining is a very stressful occupation and comes with a lot of occupational stress and unconducive work environment. In addition, the authors asserted that the job has a lot of hazards and the workers are left with the option of coping strategies. Most workers found in this field are not in the job because it is pleasurable, but because of financial constraints. This is another predictable factor for smoking behavior. In order to investigate this, the authors recruited coal miners from 6 refineries and gave them an opportunity to fill out questionnaires, after which the result was evaluated. Results showed that smoking among coal miners who were of low economic status were higher than coal miners of higher economic status. This is a very important study that could be useful for organizational behavioral psychologists. They need to work on this information so as to help with job stress, coping strategies, and unhealthy health behaviors. The next set of review was made by authors who asserted that intervention method should be associated with behavioral theories in mind. These authors asserted that tobacco smoking is a learned behavior which leads to addictive behaviors, and there is a need to include behavioral and psychological support in intervention programs. More so, smoking cessation programs are more successful when clinicians introduce behavioral techniques. It simply means that if a wrong habit has been learned, it's going to be more effective when such behaviors are